Welcome to our first weekly guideline recap. Here's a quick rundown of the guidelines and consensus statements published last week. Some of the guidelines published last week include a newly released guideline update from the American Heart Association and American Stroke Association on early management of patients with acute ischemic stroke, and two new guideline updates from the United States Department of Health and Human Services, one on prevention and treatment of opportunistic infections in children with and exposed to HIV, and the other on prevention and treatment of opportunistic infections in adults and adolescents with HIV. There were also consensus statements published, and those included two scientific statements from the American Heart Association, one on early recognition and intervention for post-stroke spasticity, and the other on prevention and treatment of maternal stroke in pregnancy and postpartum. A clinical consensus from the National Lipid Association on familial hypercholesterolemia, two clinical reports from the American Academy of Pediatrics, one on post-discharge follow-up of infants with congenital diaphragmatic hernia, and the other on therapeutic hypothermia for neonatal hypoxic ischemic encephalopathy. The American Academy of Pediatrics also released the recommended child and adolescent immunization schedule for ages 18 years or younger, 2026. And last, the American Gastroenterological Association released their clinical practice update on inpatient management of adults with inflammatory bowel disease. And there you have it. For more information and for the full guidelines, check it out on guidelinecentral.com. See you next week for another weekly recap.